Body Beautiful. I was just talking with the doctor about the calls we're having come in, and also a personal story. A friend of mine that had work done. But first, here's the phone number, 800-440-4884. And again, we'll be putting the number for the doctor's office during and at the end of the segment. So be ready to jot that down. And our caveat, any advice you receive, you certainly want to consult your own physician. Really quick before we get into the calls, a friend of mine I grew up with, beautiful girl, decided to have a nose job. I didn't recognize her.
Oh, no.
And it was one of the cookie cutter, you know, just...
Sure.
And it kind of took away her personality.
Well, if a nose is overcorrected, that is, it starts to lose its relationship to the rest of the face, it's like we were talking about before, it just doesn't belong. And it can really affect the way that people look. I mean, I think of some very beautiful women, like Sophia Loren's beautiful woman. Her nose is not a beautiful nose, but on her face, it's incredible.
Yeah, it works
and
with the
it's just
whole being.
all the parts go together.
Well,
and that's more important than the single part.
Or the Barbara Streisand, she's afraid that if she has anything done, her voice will change.
She's worried about her voice, sure.
And that's $1 million voice. All right, let's talk to Alexis from San Francisco. Good morning, Alexis.
Good morning. Hi.
How are you?
I have a problem. I fell down some stairs and I broke my nose, and I don't feel the tip of my nose at all. I have a bump on my ridge, and I have asthma. I can't breathe. It's very difficult for me to breathe. I can't breathe through my nose at all. So I'd like to know what procedure would be done, and if
sure, it depends. It depends a little bit on when this happened. If it's something that's happened within the first week or so, it can be fixed immediately, where we can push the nose back, try and open up that airway. If it's been more than a week, then we usually wait till the nose is completely healed, which is usually in the order of 6 weeks. And at that point, the bones are stuck in place, and we can see where they are and see where we want to go with them, and it gives us a more predictable result. But you'd need to have a good examination. You want to see someone who works on noses. They'll need to evaluate the outside, the inside, see if the bones on the outside have just been pushed together where it doesn't let air in, or quite frequently the septum, which is the divider between the nostrils, also is broken. And if it pushes over to one side or the other, it can obstruct the airflow. Sometimes it even makes an S and obstructs both sides.
Wow.
So it depends on what's going on in terms of how it can be fixed.
Or even scar tissue from
But if
an
it was
injury?
working fine before, you'd expect to be able to give her good airflow. The asthma is a separate component. Asthma affects the airway lower, so it affects the breathing more in constriction of the airway. That you would want well controlled before having any surgery. So that could complicate your surgery.
Thanks, Alexis. Let's try to get in Lisa from San Francisco. You have a quick question for the doctor, Lisa?
Yes. About 2 years ago, I had a rhinoplasty. They fixed my septum, and they refined the tip of my nose. About 6 months ago, I noticed that there's a little piece of cartilage that is sort of poking at the tip of my nose. You can see this little white spot. I don't really know what can be done about that or how extensive the correction would need to be.
Sure, sure.
Does that happen?
It can happen. You know, the part about nose we haven't talked about is how long it takes to recover. Rhinoplasty takes usually at least a year to get better, and I have some patients where it takes 2 years before all the swelling is really out. So there may have been a little area where the cartilage was pokey before, but you couldn't tell because the skin over it was swollen and it's thick and you can't appreciate it. If you've had it done around here, I'd go back to your surgeon and let them look at it. It's important for them to know sort of long-term follow-up, what's happened there. And it may be something very simple to correct. If the structures underneath have shifted, then it can become more complicated. But I would certainly try, if you've got your surgeon nearby, let them see you because they know what was done before, they know where things were left, and it'll give you a better result.
Doctor, is this a myth or is it true? Once you've had surgical work done, that maybe your nose is a little bit more delicate?
I don't know if it's more delicate. It's harder to do a second operation, though. I can tell you with rhinoplasty, the first time you go in, unless someone's had a lot of trauma to their nose, the skin lifts right up, and you can see the cartilage, you can see the bone very easily. After that first surgery, it heals by gluing itself down. And when you get in there the second time, it may take an hour just to get everything opened up where you can see.
Okay. And in terms of just aesthetics, and I think we're running out of time, but you use computers to model, to give people an idea before and after.
I think that's been really helpful because with the computer modeling, people can see their own face. And I wouldn't say it's a guarantee, yes, if we model it on the computer, that's the result we're going to get. But I can tell you there are times when I model what I think my patient is asking for, and then hit the undo button because that's not what they're asking for.
That's the easiest way to do it. Unfortunately,
and it's much easier to do it then.
Oh yes, we're out of time. Unfortunately, we'll have to have you back. That'll wrap it up for us. Thank you so much for joining us. Join us again at 11 a.m. for another edition of Body Beautiful. But if you want to get a hold of Dr. Mele, call him 925-943-6353. Bye bye.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.